Well, March is Colon Cancer Awareness Month, and joining us today from Mercy Health St. Rita's, we have Dr. Sheena Patel to tell us more and to kind of feel the way we should be going with colonoscopy. So thanks for joining us today, Doctor.
Thanks for having me.
Okay, so first of all, let's start out with the basics. Tell us what colon cancer is.
So colon cancer is basically an abnormal tissue growth of cancerous cells in the large intestine, which is the end of the digestive tract.
All right, and so are there signs and symptoms of colon cancer?
Sure. Usually, most of the time when patients have symptoms of colon cancer, it's usually in the later stages, but those do include change in bowel pattern, diarrhea, abdominal pain. Some people experience fatigue or anemia, and some people will even have weight loss.
Okay, so how do we detect this? What's the best tool you guys have?
So, coming from a gastroenterologist, the best tool that we recommend is a colonoscopy.
All right, and you know, people are fearful, I think, of colonoscopies when you talk about it. Is it painful? I mean, what's the process for people to get one?
I think, I wouldn't say it's painful. The most painful process that most patients worry about is the prep the night before. But the procedure itself is very painless. We give you anesthetic through an IV, and it's a twilight sleep, so you shouldn't feel or remember anything. And when you wake up, you're back to your baseline, and you're able to leave the center.
Many times you hear people that have a polyp. I guess you can remove those during a colonoscopy, right? Is that like a sign, perhaps?
Correct. So a polyp is the start of abnormal tissue or abnormal cells that are growing in your colon, and those actually end up turning into cancer. So we usually say, as a rule of thumb, it takes about 10 years for a polyp to turn into cancer. And so when we're doing the colonoscopy, we do use tools to help us remove those growths and prevent the polyp from growing further.
So what is treatment like today for colon cancer?
So, it all depends on how extensive the disease is. And so, if it's localized and it hasn't spread, some people can have surgery and do pretty well. Some people need radiation or even chemo.
Okay, so Dr. Patel, what's the age that we should be looking at this and thinking about, colonoscopy or making sure that, we are healthy in that area?
Correct. So the age limit has actually changed in the last few years. It used to be 50, but now, since we're seeing a lot of colon cancer in younger adults, we've actually switched it to 45. That also changes if you have a family history or a genetic predisposition to colon cancer. If you're having signs or symptoms, obviously you should get screened earlier as well.
I mean, I don't know if you know this, but you mentioned that we're finding it in younger people. Is there a reason why? Any theories?
So, there's a lot of thoughts, different schools of thoughts, but there's thought that genetics play a role, but also environmental. What we consume and our environment around us affects that colon cancer as well.
What about gender? Men and women both have to worry about this, or is it target one gender or another?
No, it's actually pretty common in both men and women. It's actually the second most common cancer, leading cause of cancer in both men and women.
All right, so during this month of March, we need to be aware about this. And thank you for bringing up this issue, Dr. Patel.
Thanks for having me.
All right, don't go away. New Edition continues in a moment.